Okay.
Good.
Okay. Thank you so much.
I'm trying to find my cursor so I can get rid of that got it part, but I don't know if that's going to go away. So I love this little cartoon because, you know, if we have dogs, y'all got dogs, everybody has dogs. Do we have dogs? Yeah, some people have dogs. Okay, so, you know, dogs make us feel like we're so important and special because they just love us unconditionally. Cats, however, they are what grounds us because they let us know that we're here to serve them, not the opposite. How do I'm trying, okay, here we finally got it. So in the world that I live in, there's so much polarization, and I think you guys are experiencing it as well, where you have to either be all Western medicine or you have to be all Eastern medicine. And I really think there's a difference here that we shouldn't have an either or, but it really should be an and it's how can we blend the best of both worlds to give us the best possible outcomes. So whatever toolkit I need to expand to, that's what I'm looking for. Now, a lot of people don't know how old our animals should be living to. So I just wanted to throw this in. This is Cream Puff. Cream Puff was recorded in the World Guinness Book of Record in 2010 for being 38 years and 3 days. She was owned by a farmer in Texas, and he had another cat that was recorded to be 34 years of age. And they are not the enigma. Maggie lives in Australia, was clocked in at 30 years young. And there's now been another dog. I don't think he's in my slide presentation. That is 30. Yep, there's Bobo. Bobby. Bobby is now 31 years old. So we should not be accepting the fact that our animals are dying as early as they are. And this is my cat. This is the same guy that you're looking at right here. And he's 22. He was a feral cat when I got him. And he's been eating raw for over 10 years as a diet, no vaccines, et cetera, et cetera. And he is thriving. So if you see other people that have cats that are in their late teens, they're really skinny, they're emaciated, their coats are bad, their eyes are dull. He has none of that. So despite the fact in veterinary medicine that we have a pill for every ill and a diet for every disease, we are seeing the highest rates of chronic disease that we've ever seen in our industry. 5 years ago, the statistic was that cancer was in dogs 1 out of 1.65. Right now, I would say it's almost 100% because we see so much cancer in dogs. Cats, they said, was 1 out of 3 statistically. I think that's highly underreported. But if we include obesity, autoimmune disease, arthritis, allergies, and gastrointestinal diseases, we see nearly 100% of our animals having some form of disease. And just gastrointestinal issues has, in the past 5 years, gone up over 50%. And the worst part of it all is that the life expectancy of these pets are going down by 7 years compared to 20 years ago. So something is not working and we need to do something different. Last but not least, the antibiotic resistance. I'm sure you guys are seeing it as much as we are, but we're seeing so many conditions where you do a culture and there's nothing that's going to touch it. So I was seeing this come on and I realized that we really needed to have something that was safer and more effective as an alternative. And that's when I got into doing photodynamic therapy. Well, the KISS principle, you know, it's keep it simple, stupid, but nature does nothing stupid. Nature's pretty intelligent. So nature does things that are sustainable. So that's what I try to model is keep it simple, sustainable so that we can be successful. This is the 6 keys to health and healing that I use for every single patient. And this is what I model in my own life. So step number 1, we just have to stop doing the things that are causing the diseases. And it's a little easier with animals because we can get people to do things for their pets that they won't do for themselves. So it's so interesting. But we look at pollution in food, water, environment, what they're eating, what they're breathing, what they're touching to their skin, the EMF. So we cover and teach all of that. How can they reduce that? And then number 2 is making sure that they have all the essential nutrients. And you guys know that the essential nutrients are those that the body can't produce in sufficient quantities. Third, we work on healing the leaky gut, which is really a huge problem for our pets because so many of them are not eating a species appropriate diet. They get a lot of gut inflammation. Number 4, we detoxify all 6 organs of elimination. So we focus on kidney, colon, lungs, liver, skin, and lymphatics with a special attention in my practice for the liver and the lymphatics. I just think they do the most hard lifting. And so I really work on paying attention to them. Then we work on mitochondria, making sure we have good mitochondrial biogenesis, that these mitochondria are functioning well, they're communicating well with the microbiome. And number 6 is we clear trapped emotions. So as I present the cases, I want you to be aware that all 6 of these principles are applied to every case. On the left is our traditional toolkit, but they say that if the only thing you have is a hammer, then everything starts to look like a nail. Well, today we have so much more complexity to the diseases that we're seeing that we have to have something past the standard CBC chemistry, thyroid. For animals, we do heartworm testing, leukemia, AIDS, urinalysis, digital X-ray, of course, should always be done. Ultrasound is a pretty standard modality in veterinary medicine now and doing echoes. But when we get into doing integrative work, I think I am being blocked by our pictures. So let me move that over. Okay. And so we've got thermography, we do cancer markers, CRP, vitamin D, B12, magnesium. We look for, okay, now that I move that, it's messing up my screen. Okay, heavy metals. I do live blood analysis in my practice, not nutritional blood analysis, but I'm looking at the 4th phase of water. And then I do bioenergetic scanning, use a lot of intuition, some muscle testing. And then in the Western treatments, we have the non-steroidal anti-inflammatory, steroids, antibiotics, and then that's their big guns, and then surgery, chemo, and radiation. But in the integrative world, we have so much more. We do photobiomodulation, we do ozone, we do lymphatic therapy, acupuncture, pulse electromagnetic frequencies, therapeutic lasers, chiropractic, molecular hydrogen. We use these crystals that go through full spectrum light, and then salt therapy, hyperbaric oxygen. We use photoactivators with PRP and prolotherapy, infrared saunas, herbs, oils, homotoxicology, energy work, clear emotions, of course, food, water, and essential nutrients. And detoxification is a big component of my practice. So that's a smattering. There is actually more, but you get the gist of it. So this is the reason why I'm doing integrative medicine. So that is Demi Marie, my youngest daughter, and Lily LaCrue, one of our show horses. These two were not just horse and rider, they were best friends. They were also almost undefeated at the local, regional, and national levels. And then there was the show where something went ghastly wrong. This is not a picture of my daughter in real life, but this is what happened in the arena. Lily reared in the air. No one had taught my daughter that if your horse rears, you just bail off, get out of the way. The number one cause of a rider's death when a horse rears like this is being pulled over backwards and crushing their rider. So we had a 50-pound child and a 2,000-pound horse. And because my daughter was literally hanging and dangling from the reins, she was pulling her horse over backwards and she was going to land on her. In the midst of being pulled over backwards, this horse had the presence of mind to feel where my daughter was falling. My daughter was falling to the horse's left, and she squatted on her left hind leg and pushed herself as hard as she could in the opposite direction. However, when she hit the ground, you could not see space between my daughter and the horse. I'm already jumping over the railing and I'm running towards my daughter, truly not knowing what I was going to find. Well, in that couple of seconds, Lily caught her breath and she got up, but my daughter wasn't moving. She was still lying on the ground, rather motionless. I got there and thank God, by the grace of God, she was not hurt, just knocked the wind out of her, and she was really embarrassed. So she was fine, but that didn't end the story. Back home, we had several more episodes where this happened. I had equine veterinarians come out and take a look at her, and they said, Dr. Siegel, we don't know what's wrong with her, but she's not safe to ride. She'll never be shown again. And here are your choices. You can put her out to a pasture and retire her, or you could put her down. Well, aside from the fact that this was a 7-year-old mare who was a United States National Open champion, and she was a U.S. Canadian National Open champion, she took my daughter around the arena safely for a long, long time, and she saved my daughter's life. So those words were not acceptable to me. And I started then looking for other things. And I wasn't blaming the veterinarians for not knowing what else to do. That was the end of their toolkit. And so as I started adding more things into what I was doing to fix Lily, I started incorporating those things into my practice. And that's why today I have the most robust integrative practice of anywhere in the entire world. And that was my commitment to my clients. I said I would never, ever utter those words, that there's nothing more that can be done. And I've held that promise for over 25 years now. And the end of the story was this dynamic duo, 5 months after I was told she would never be safe to ride, won the United States Youth Reserve National Championship. And Lily is still alive and lovely in my backyard. So in veterinary medicine, it's a little different because our patients aren't always talking to us. They do talk to us in their own way. We just have to be more attentive, but we have to be really diligent to do good workups because they don't always present for what their problem is. So this was Delilah. She came in limping on her back leg. The owners had no other complaints, but when we did the x-rays, we saw something in her abdomen, and she had these 2 huge tumors that were growing in her abdomen. The owners chose in this particular case to not to do anything, and this dog was euthanized in less than 2 weeks. This is Wiser. She was also a 2016 model, came in for limping on the front leg. These dogs are eating processed foods. This dog had chronic ear infections, chronic skin disease. We did the x-ray, and I didn't even realize the owner came up behind me, and I looked at that x-ray, and it was basically a snow globe. And I went, oh, geez. And then she said, what's wrong? And I didn't realize she was standing behind me. But she was a very different owner. She chose to go in and start making changes, lifestyle changes, and doing therapy. So here she is in the salt booth with her dog. That's Wiser on the floor. And this dog, with the therapies that we did, lived over a year with 100% quality of life. And then there was that day when the owner just knew it was time to say goodbye, and we did it with gracefulness. This is Rufian. She's an 8-year-old intact female dog that presented to an emergency clinic for acute vomiting and anorexia and ADR. I don't know if you guys use ADR. It's ain't doing right. And that's a lot of what we hear from the owners, that they just not right, doc. And so the emergency clinic did not do a workup on this dog, and they sent her home with some anti-vomit medicine. So we did 3 days later, she comes in to see me, and she's not doing any better. So we did a full workup, and we found that her white blood cell count was horrifically high. Normal white count for an animal is going to be around 6,000. She was 47,000. And she was an intact female dog. So infected uteruses are probably the #1 differential. And that was my #1 differential until I did the ultrasound, and I found that it was not a pyometria. What this dog had was a urolith that had gotten stuck in her ureter, and it was causing that kidney to die. So I did send her to the University of Florida in hopes that they could remove the stone and save the kidney, but 48 hours later, they said that wasn't going to work. So they quoted this owner something like $18,000 to take the kidney out, and they didn't have that kind of money. So she came back to me on a Saturday night, and my daughter and I went and did the surgery. I will tell you that surgery was worth every bit of $18,000, but I didn't charge that. It was the hardest surgery I'd ever done, because this dog's kidney had been dying for probably a couple of weeks, and everything was full of pus. The kidney was literally spewing out pus, and there was so much adhesions, and nothing was normal anatomy in there. But we were able to do the surgery successfully, and she lived a great life after that. So most of our diseases, in my opinion, and this is what I try to keep it simple for my clients, is defining disease as dis-ease. It just means the body's not in balance. I don't think there really is disease. And it's either because of a deficiency of essential nutrients, or it's an overabundance of toxicity that the body can't deal with. And on top of that, we have mitochondrial dysfunction. So with that being said, it helps owners to define a little bit more about what may be happening and what we can do about it. So we do thorough workups, like I explained before. We got the full CBC chemistry, UA, T4. I don't scrimp on anything because I'm not going to miss anything and make a mistake. We do x-rays. We do, I can't see my screen because my thing is in the way. Know how I can move that again. So we got x-rays, ultrasound if appropriate. We do heavy metals, nutrient panels. A panel that we run, a TK1 is what we use a lot. I know it used to be used in humans. It's not used a lot, but that's one of our cancer markers. CRP in dogs. Haptoglobin is what we measure for cats. And then we look for vitamin D, magnesium, and B12. It's really interesting. There was a university study that looked at dogs eating processed foods, and 85% of dogs that were eating processed foods were vitamin D insufficient. And that's because carnivores, which is what our dogs, cats are, only get vitamin D from their protein source. They do not get it from the sun. So if whatever they were eating was not grass-fed, grass-finished, and it came from a feedlot, that animal is going to be vitamin D deficient, and consequently, whoever eats that animal is going to be vitamin D deficient. So it's a really big problem in our industry. And sadly, most veterinarians aren't even looking for that. And as you guys know, vitamin D and magnesium run the innate immune system. So you can imagine these guys are eating all this toxic food, and then they're vitamin D deficient. And it's a wonder that they make it as far as they do. I mentioned earlier that I do live blood analysis, which is for evaluating the fourth phase of water, bioenergetic testing, and then thermography and CT is also available in my practice. So now, all right, now I'm going to go into some of the therapies that we do and then give you some examples. So we know we don't heal unless we're in a parasympathetic state, and that applies to our animals as well. And since they're living around, they're stressed out pet parents, most of these animals are in very high sympathetic tone. So we use a machine called a magnosphere, and that's what the machine is in the picture there. And we can control we can do full sympathetic, we can do full parasympathetic, we have ability to create a lot of different frequencies. But the first thing that I'm using it for is to get these animals into a parasympathetic state. And then this is an example. This is really fun. I want to show you this video. And as I'm playing it, all right, this is how angry this bird is. He's trying to bite his daddy.
Let's see what he does. Takes about a minute.
And I'm playing a frequency music that will help to calm the bird down. And he's mad. So this bird is
rambunctious.
He's 22 years old. And if you notice in the picture on the left, his beak is super, super long. And what happened when he was a baby is he got his beak caught on a wire that was in the cage, and it split the beak in half, the lower beak. So they went to a couple of doctors and they were told to put the bird to sleep, that they never survive. Well, 24 years later is when the bird finally left us, but he would come in every 3 to 4 months for me to file down the beak that was growing extra long. And he was mad. He was just not a happy bird. So now I'm going to show you this. He allowed me to cut his beak off one-handed. I did everything just holding him myself. And because of the music allowing him to relax, he's now letting me pet him and not trying to bite me. Really cool. All right, that was Chirp. This is just another example of a dog that I did with that same frequency music. Lucas came in because he was very ADR, and he's only 6 months old. So we did x-rays. We saw that he needed a spinal alignment. I'll show you his x-rays in a minute, but the owner could not hold him. This dog is so hyper and he's really strong, and she just wasn't able to hold him still. So we started playing the music, and I want you to watch his eyes. They start getting really heavy. He's blinking. She's not holding him any longer. He's just laying on the table. He laid down by himself. We're about 3 minutes into the video. And then about another minute or so, he's going to take a big yawn. And now he's just going to lay his head down. This is just using frequency music without having to give him any drugs. Boom. Now, the question is, can I adjust him? So here we are, still playing the music. No manhandling. He's not trying to leave, and I'm able to adjust him. So this was his before x-ray on the left. If you were to look at his top line, it didn't really look like he was out of alignment, but when you look at the radiograph, his back looks like he has a T in it. And then after we adjusted him, his back is nice and straight, and his ADR went away, and he was absolutely normal after that. This is Suki. She went to an emergency clinic for severe diarrhea. And the emergency clinic did blood work on her. They did not check her for pancreatitis, which they should have. And her ALT was over 9,000, which is super high. You know, they should be under 90 for dogs. And so they treated her for the high liver enzymes. And then a month later, liver enzymes were normal, but the dog still wasn't quite right. So she came to me a few months later, and we did a workup on her. And this is her live blood. So you can see she has a lot of rouleau, and in the background is all that fat. And I asked the owner, when was the last time they fed her? And she hadn't eaten in over 7 hours. So I had an idea that we were going to have a problem with triglycerides. And sure enough, her triglycerides, when it came back, was super, super high. So we started her on a change of diet, and we put her on some enzymes, and we put her in our Magnosphere. Now, she only had a couple doses of enzymes, and she wasn't even fully transitioned onto a raw diet, but we had her in our Magnosphere, and this was literally 24 hours later. So all the rouleau is gone. Half the fat is gone from the background. And this is 72 hours later. All the fat's gone, and the cells are gorgeous. They're moving, they're flowing. The dog is feeling fantastic. Here we have the before and the after, and her triglycerides 7 days later. I really would have tested her earlier, but it was over the weekend. So when I retested her, her triglycerides were down to 125, which is normal. And that was using no drugs. Pretty cool. All right, little Burger. He was a 2010 model when he came to me. He was just going to the University of Florida to remove a lipoma, but the owners wanted to be more proactive and do more things to make sure he was healthy. So we did a full workup, and we did his live blood. We were actually doing a study with that music. So we just played around with it, and we were playing the music for him after we did his initial pre-blood where he had all the rouleau. And then on the right-hand side, that was literally 5 minutes after we started frequency music on him. So that music has a frequency that changes the fourth phase of water, expanding it and helping that blood to be more functional. And this was his pre-chiropractic on the left. He had a big curve in his back. And the reason I'm showing this is because many times veterinarians assume that that's positional, but we know it's not positional in my practice because they're in a trough. We're positioning them with the person at the front, the person at the tail, and the plumb line is going right down the center of this animal's body. So we know what it looks like from the outside, but on the inside, we can see that there's a problem. And then on the right-hand side, you can see him immediately following an adjustment. Crystal fusion light therapy is another one of the things that we do. It's basically different kinds of gemstones that passes through full spectrum light. And another way that we use light is as a topical method. So we have a laser that is more for just surface things. It's red light, and it's red and infrared light. And it also has blue light. That's the laser on the left. And on the right is our endo laser. This is a Weber laser that we can use intravenous, intraarticular, intralesional. And I'm getting a therapy with my daughter in Mexico. On the left-hand side and the middle picture, I'm doing a dog that had a ruptured cruciate ligament. And instead of taking to surgery, the owners wanted to do Prolo and PRP. And then we photoactivate the products with our endo laser. And these dogs typically walk as soon as they come out of surgery. And then on the right-hand side, it has a little shower head off the same machine, so we can do topical application as well. I'm sure you guys are familiar with photodynamic therapy, but I just wanted to make the emphasis that when we're using antibiotics, we're really limited to the bacterial population. But with photodynamic therapy, we're covering the spectrum, and we have no downside of it and no deleterious effects and no resistance. Another tool that we use is full spectrum infrared therapy. I like to model after nature. And so I figure if the sun produces full spectrum, then that must be what we should be doing. So we have a technology that has very, very low EMF, and we have it in the form of a mat, which is really nice for the cats and dogs. They prefer being on a mat than being inside of a sauna. But we do have a sauna for them as well. And then on the right-hand side, those are the individual saunas where if somebody wants to go in with their pet, they can, but it's kind of nasty to be sweating that much and have an animal on your lap. Assisted lymphatic therapy, I told you in the beginning, the lymph system is my love. And so we do a lot for lymphatic therapy. This is a machine that we use that creates a microcurrent, negative ions, and inert gases. It's extremely well tolerated by the patients, even for cats, and very effective for helping to decongest the lymph, open drainage sites, and then be able to sweep the lymph into those drainage points. Boost the immune system, aids in detoxification. I'm just doing a little lymphatic. I was being cute that day, so I'll go past that. and give you an example of how it actually works. Because a lot of times we don't get to see what the actual physical effect is. This is Popcorn. He's a beautiful show dog, and he's also a service dog for his mom. He's trained to let her know when her blood sugar drops. So his presenting complaint was chronic intermittent vomiting. He would go for days not eating, always having diarrhea. We ended up diagnosing him with irritable bowel syndrome. And here I am doing part of his lymphatic therapy. So I'm just working on the neck area, but we do the whole body. But this is what I wanted to show you. So on the left was his live blood before I did the lymphatic therapy. And on the right is his blood after. So not only is the rouleau gone, but look at the motility, the movement of these cells. It is so dramatic. And I think that part of that may be from the ozone that is infused through the skin. So an example, this is Hope. She was actually one of the earlier pictures. Her owner lit her on fire and obviously severe burns and abuse. So she was rescued by a rescue in Sarasota, and they treated her. She was able to recover, but about 3 years later, she developed an immune-mediated rheumatoid arthritis after spiking a very high fever. So when she came to me, she was unable to walk. She hadn't eaten in days, and she just felt terrible. The only two things I did on day one was a chiropractic adjustment and lymphatic therapy. And I no sooner got done than she got up off the trough, started walking around the office. I offered her some freeze-dried raw food and she gobbled it up. So she continued to do well. We did a lot of other modalities on her over the next few months, but she ended up recovering fantastic. And there we go. So lymphatic therapy is a very well-tolerated modality in the animal kingdom. And in my opinion, it really should be part of a wellness program. I passionately feel that we should not be waiting until these animals present with illnesses to start doing these modalities. We really should be incorporating them into a program where we're being preventative. Then after they get their lymphatic therapy, they go into the foot bath. And this is Popcorn again. Of course, it has to be a brave me that puts a white dog into a foot bath, but it does wash off, so no worries. This is another way that we do our foot baths. If it's a really big dog, we'll just, like the dog on the left-hand side, she has an osteosarcoma. You can see the big area of swelling on her right front leg. So we just put her on a mat, layers of cushions, and then we just put her front feet in. And then if they're small, we just put them in the whole tub and they just do fantastic. Even cats are extremely tolerant. This is one of my favorite technologies. It's a vibration plate with sound frequency. And again, it's like a Rife machine with a vibration plate. So very well tolerated. The animals like it. And this little dog was the first dog I treated when I got that technology. So she had been to her veterinarian because the dog couldn't pee. And the veterinarian correctly diagnosed her with a transitional cell carcinoma in the bladder. However, the veterinarian said there was nothing more they could do and they needed to put the dog to sleep, and the owner wasn't willing to do that. So she went to another veterinarian. She got the same answer and the same opinion that she should put the dog to sleep. She still didn't like that answer. She went to a referral center and they said, not only do you need to put this dog to sleep, but if you don't do that and you leave with this dog, you are a cruel and inhumane pet owner. Well, she was really pissed at that comment. So they drained the bladder for her and she came to me. And I put this dog on my machine. There was an actual setting for transitional cell carcinoma, which was pretty cool. And I treated her that night. First I drained the bladder, put her on some medications, which she didn't even have time to start. And then I did a 45-minute therapy on her bladder. And I called her the next day and she goes, oh yeah, she's peeing fine. Like the owner didn't get the significance of what just happened. And a year later, oh, this is the bladder tumor. We just had it on a picture for you to see it. These were just some of the things that we did in her therapy. But the cool part is 12 months later, she's still alive, doing great and peeing. Cancer's still there, but she's living with it and doing fantastic. So animals are much more intuitive than the average person. And so these two snakes came in and they were ADR. The owner had just purchased them and he just felt like they weren't quite right. On physical exam, I didn't see anything abnormal. And I said, you know, let's put them on the vibration plate with some frequency and let's just see what happens. And what was so cool about this is both snakes curled up underneath the cell exciter, which is where the concentration of the frequencies is. and they both wanted to be under there. They could have moved elsewhere in the cage, but they didn't. I thought that was pretty cool. And there's Echo again. He's on my lap right now, as you can see, and he loves getting on that plate. Halo therapy, we do a lot of dry salt therapy where it acts sort of like a toothbrush. When you're breathing in this dry salt, it's a medical grade sodium chloride. It scrubs the sinuses down into the trachea and down into the lungs. So we use it for any of our cases that have upper respiratory tract infections, cancer, and it's also wonderful for skin diseases. So we use our booth a lot. So the little guy on the right, he came in as a kitten. He had an upper respiratory tract infection. In cats, these typically turn into be chronic long-term shedders and chronically just relapsing time and time again, and they're really hard to clear up. But they have watery eyes, they're squinting, they have a lot of conjunctival edema, and they have runny noses. We put him in the salt room. We had 3 treatments in a row, gave him rectal ozone, changed him to a raw diet. That's what some of the things that we did. And then 24 hours later, the nasal discharge is getting less. His eyes are clearing up. 1 more day later, he is perfectly normal. All symptoms gone, and he never relapsed after that. This is Bam Bam. Bam Bam was outside, and the owner said all of a sudden she started having severe respiratory distress. She didn't know what had happened. Well, it turns out that she had inhaled something in the yard. We don't know what it was, but on the left, you can see her right lung lobe is got some edema and consolidation in there. We did salt therapy and rectal ozone and vibration and sound frequency, no antibiotics. 3 days later, her lungs were perfectly clear. She was symptomatic free in 24 hours, but radiographically, it took 3 days. This is little Canella. She was 4 months old. She had a bronchopneumonia. She was taken to the emergency clinic and they put her on antibiotics, and she just continued to get worse and worse and worse. So when she came to me, we stopped the antibiotics. You can see on the left, her lung fields, you can't even see her heart. It is just one consolidated gross area. And we started her with the similar therapies, vibration frequency, salt room, no antibiotics, a lot of ozone. And then that was the ventral dorsal view. The left is presentation, the right is 3 days later. And her also symptomatic wise, she was breathing and starting to play and eat in just 24 hours. This is Daisy. Daisy was a partial drowning. She'd fallen in the pool. And before the owner realized it, Daisy had splashed around and finally made it over to the steps. So at first the owner didn't think there was any problem because she looked okay. And then about a half an hour later, she started vomiting up frank blood. So on presentation, she was hurling frank blood. We started our therapies radiographically. Of course, her lungs looked terrible. We started doing our therapies on her. And by that night, all of the vomiting and coughing up of blood had stopped. She was breathing better. Her lungs didn't look better on radiographs yet, but clinically she was doing better. We treated her for 3 days in a row. Here she's getting her vibration and sound frequency and lymphatic, and kind of blend things together sometimes to maximize our time. And then her radiographs in 3 days started clearing up beautifully, and that coincided with her feeling a lot better. So there she is, all recovered and doing wonderful. This was Ellie. And the reason I wanted to show this case to you is because she's 14 years old and she developed collapsing trachea. So she was diagnosed at Elsewhere Clinic and was taken to a referral center. And they said there was nothing more they could do, that she had no quality of life. She had no ability to even go on walks. She was coughing nonstop. She couldn't catch her breath. And the owners just really didn't feel like they had done enough for her and they wanted to try something else. So when I started seeing her, I did my full workup. She was vitamin D, magnesium, and B12 deficient. She had high TK1, she had high CRP, she had a heart murmur, which was only B1, so no medication needed. She was hypothyroid, had a high white count. She had tons of struvite crystals in her urine, high urine pH, and she really had a hard time breathing. So we started our therapies. We saw her 4 days a week in the initial month, and then we went down to 2 days a week as she was getting better for another 2 months. She had some chiropractic work. We did our similar therapies and lymphatic. And within the end of her 3rd month, She had no more coughing, and she had 100% quality of life, eating, playing, and acting like a young dog again. Isis was also one of these chronic seborrhea, chronic ear infections, chronic pneumonia. She was sick all the time. We do her on a regular basis. She goes at least once or twice a month. She comes in, she gets salt room therapy, rectal ozone, hyperbaric oxygen. We do sound and vibration frequency, lymphatic therapy, and she is now pretty much symptomatic free. She's maintained herself doing great. That's her and Ellie on the vibration plate together. Isis didn't care to coincide. All right, so this is Buddy. He was 17 years old when he came to me. He had jumped off the couch and he was all stoked. He literally looked like a caterpillar. He could not straighten his back out. So we took the x-rays and we did our therapies on him. And then we did a post x-ray after we did our treatments on him, and his back was all straightened out. And I think he lived to be almost 20. This is a different dog. This was Casey. Casey came in ADR. And when we did the x-rays, of course, we see a spine that looks like an S curve. We did thermography to show that there was a lot of inflammation along the spine. We did his adjustments, did some ozone, repeated the x-ray and the thermography, and you can see his back is straight and all the inflammation is gone. Ozone. I don't know if you guys do a lot of ozone. We do a massive amount of ozone. Nobody leaves my office without ozone. Even if they're doing well, we can always use a little bit of a hormetic stressor. So we do it intravenously. We do minor autohemotherapy where we mix it not only with blood, but we sometimes put homeopathics in it. Rectally is probably the most common way we use it. We can bubble it through oil and use it to breathe the ozonides, but we typically don't do that one a lot. Subcutaneous, we can inject it either in fluids or just gas by itself. We do topical lavages, oral rinsing after our dentistry, and also as acupuncture. Again, a lot of times we don't get to see what is the effect of these therapies. So on the left-hand side, you can see it's not even rouleau. This is what I call aggregation. And then 10 minutes after rectal ozone, all those cells are now separated. So ozone must have some really profound effect on the fourth phase of water, and it happens really rapidly. I like to show people, because sometimes, you don't see ozone, it's a gas, it goes up the butt. Did it really do anything? And this is one way we can prove that it has a massive effect on the body. So this is Max. Max, we get this phone call from a person we've never met before. He goes, my dog has a skin infection and it really smells bad and we can't seem to clear it up. They were trying to do home remedies. So Max comes in and I start to rinse his back off and the skin starts to slough and all the hair starts to slough. Smelled horrible. He had a Pseudomonas infection. We ended up culturing it and got that back a week later. So I didn't have any history. All he said was the dog just happened to have a skin infection. Well, after biopsying this dog, it turns out that the owner had a girlfriend, and the girlfriend left the dog out in the Florida sun with no shade in the middle of summer, and he suffered 3rd-degree sunburn. So it was really, really infected. We thought we were almost going to be able to save his back and the skin, but then it started to crack and it literally looked like a turtle with his skin starting to crack off. But the whole time we were treating this dog, happy, wagging its tail, eating, seemed to be pain-free, even though we were giving him some pain management, some CBD. Okay, it's going to get a little gross, guys. So if you want to close your eyes for a minute, but I thought this was pretty amazing.
What is today's date? August 27th.
So
This
that
was the whole back
dead
area that was just peeling up
just
and off.
lifted off. But look at that beautiful granulation bed underneath. How cool is that?
Actually doesn't look too bad.
Yeah, it really looked great. And when we put ozone on it for the last time, it bubbled up. So we quit doing the ozone. So here he is on August 31st. You can see it was a large part of his back. I mean, a lot of times with as much surface area that was damaged, that could have been fatal. And then 1 week later, we were doing collagen wraps with this dog. We got about 50% more closure. And then a couple months later, we have almost total closure. And then finally it fully closed. I did not have hyperbaric oxygen at the time I did this particular case, but you can see he has fully healed, and we have the state of the United States is on his back, and there's Florida right there on the bottom. Now that we have hyperbaric oxygen, we get much faster wound healing. On the left, I'm doing a dive with 2 of my cancer patients. And on the right, it's just showing a dog that's in the hyperbaric with me and just how roomy it is. There's a lot of space in there. So this was Dottie. She went into her veterinarian for a C-section, and she ended up having a heating pad on her belly and got 3rd-degree burns from the heating pad. So she was transferred to an emergency clinic, who immediately transferred her to me because they aren't able to do all the modalities we do to try to save the skin. So you can see everywhere that it's really kind of dark gray brown, that was all tissue that was starting to die. So we did our therapies on her, and my number one concern was that it was going to encroach all the way over into her surgery site line. And I was afraid that we were going to dehiss that whole site. But fortunately, we were able to get all the damage to stop. And then we started to get contracture. The dead skin fell off in about 2 weeks. And she was getting hyperbaric every day. And from the 2-week point, 3 days, 50% more closure, 3 more days, almost 100% closure. And then it finally healed in. So her total process from the time that I saw her to the time that she was fully healed was only 3 weeks, where max was several months. So I think the difference was the hyperbaric oxygen. This is Dazzle. We see little chickens too. This chicken came in, as she's owned by a friend of mine, and she was going to put her to sleep because she didn't think anything could be done. Little Dazzle had a vent full of maggots, and it really stunk bad. But maggots we know are good. So I ended up flushing this with ozone and lasering it. I'll show
Right,
you
so we
just-
can see there's a lot of maggots all in the perianal area. She laid an egg this morning.
So I'm
and
just
we're
rinsing it with
flushing
ozone. And that actually killed the maggots. They started dropping off. And then we did red light therapy, and then we did blue light
And then we're
therapy.
doing the
The
blue
blue light was really
with
cool because the
laser
maggots shine up with this really cool
as
color.
our antibacterial.
But vets like that kind of stuff. Here's the mic drop. This chicken was fully recovered, all tissue healed in 48 hours. This is Holly. Allergic skin disease is probably the number one thing we see in our practices as veterinarians, but right up there is cancer. So this dog had been to 3 different veterinarians, multiple rounds of antibiotics and steroids and non-steroidals and Apoquil and all these drugs that are coming out to treat allergic skin disease in dogs. So when she came to me, I wanted to make sure I had an accurate diagnosis, and I did a full workup, including biopsies, cultures, and histopathology. Diagnosis came back. She had allergic skin disease, so we changed her diet, got her on some therapies, and this is her 3 weeks later. Her itching, which is the reason the owner brought her in, because she was incessantly itching, that was gone in 3 days. And then her skin was fully healed in 3 weeks. This is little Ritz, 14.5-year-old, presented for a sudden ataxia and circling. So number one differential in his age category is, of course, a brain tumor, but he also had a really bad ear infection. So I opted with, let's treat the ear infection, see how he does. And we used a combination of laser in his ear along with ozone rectally and topically. So here he is getting lasered. This is him 24 hours later. Boom. And he lived another few years. That was pretty cool. Snake bites. We see a lot of snake bites in Florida, and the swelling on the dog on the face of the left side, you can see, is pretty profound. Typically, snake bite swelling will continue to get bigger and bigger and go up over the eyes. And it takes literally days and weeks for that swelling to go away. But with laser therapy and ozone, we were able to resolve all that swelling in 36 hours. This is what the blood looks like. So we get a lot of echonocytes, which is our hallmark for knowing it's a snake bite. And then 18 hours after our treatment, her blood, all the echonocytes are gone and her blood's back to normal. And she did great. This is Oreo. He came in because his owner thought he had a foreign body. She saw him nibbling on one of her plastic plants, but he didn't have a foreign body. He was actually in kidney failure. Don't know exactly why or what happened to cause that. He was only 7 years of age, but these are pretty high numbers, getting a BUN of 76 and a creatinine of 6.4. The SDMA is a marker of long-term kidney damage, and that was 46. So I'm thinking something that was going on in this cat long before he presented. Phosphorus was high at 8.2. So we started doing our therapies. Here he's getting lymphatic therapy done and ozone and everything's listed on the left. I won't go through it all, but there he is getting lasered. We laser right over the kidneys. We use 5 hertz and 50 hertz, and it really gets down into those kidneys and helps. And so 24 hours later, he's also on IV fluids. Now his BUN and creatinine are almost back to normal. We continued for another 24 hours. His live blood, he had quite a bit of rouleau when we started. And then in 24 hours, all the rouleau was gone. And that seems to be one of our hallmarks to know how well these animals are going to do, is when the blood is able to separate. And then his blood work at the end of 72 hours was totally back to normal, started eating, and he never had a relapse. Little Abby, one of my favorite patients ever, came to me when she was about 2 years of age, and the owners adopted her from a different person that they knew, because the dog was always sick and not thriving and wasn't eating and was skinny and losing weight. And the original owners couldn't take care of her. So these other people adopted her and they brought her to me.
She's doing a lecture right now.
It was a pretty arduous process to get a diagnosis, but we ultimately diagnosed her with a hepatic shunt. And I sent her to the University of Florida to see if it was a surgical correction, but sadly she had no portal vein. Well, the University of Florida said to the owners, well, she doesn't have a portal vein. We can't do surgery. She's never going to do well. She's always going to have troubles. And you might want to consider humane euthanasia. But these owners did not want to do that. So they brought her back to me. We did our therapies, which are listed on the screen, the Magnosphere for her parasympathetic and being able to vasodilate, the laser, ozone, lymphatic therapy, changed her diet, had her on some special supplements. And 3 years later, she was still doing fantastic. So here she is. She's going to give us a money shot here in a second. Every time she came in, she always did that and then gave me that belly shot. So that was my money shot. Cutest thing ever. So she had 3 more phenomenal years feeling that good before she developed an immune-mediated thrombocytopenia, and she passed away in just a matter of hours. But on the left is how she presented. On the right is how she spent most of her life. This was Cookie. She's a little dachshund that was diagnosed by a referral center with IBD 4 years earlier. So for 4 years, this dog every couple of days would suffer with a grumbly tummy, diarrhea, abdominal pain, vomiting, and just feeling horrible. And they couldn't offer her anything. Everything that they tried to do, nothing worked. So she came to me. We did 4 days of therapy with chiropractic work, a vibration and sound therapy, lymphatic, assisted lymphatic therapy. We did rectal ozone, put her on a raw diet, got her on digestive enzymes, kefir for some pre and probiotics. We did a fecal matter transplant, which made a big difference in this dog. And 4 days later, she had a normal bowel movement. And she has been normal ever since. This dog came to us because it had presented to their veterinarian for nystagmus and ataxia. So they went to the veterinarian tried to do some stuff. It didn't get better. They went to a referral center where they gave this dog gobs and gobs of drugs, but the dog continued to get worse and worse. So she came over to me. This dog also had chronic skin disease. From the time this dog was adopted, he had ear infections, he had chronic skin problems, and then of course developing this head tilt. So here's a video of him walking. He's actually looking better walking than he really was. He was very splay-legged and not able to walk a straight line. So I talked to the owner about taking a different approach. And my approach was to try and reduce inflammation. So I wasn't really targeting the head tilt or whatever skin problems he had. I really was just targeting the inflammation systemically. So I chiropractically adjusted him. We did the assisted lymphatic therapy, did a foot detox. We did major autohemotherapy with ozone. And then he had IV vitamin C, poly-MVA, curcumin. We did the rainbow colors with the laser, got him on a different diet and some supplements. And this is immediately post his first treatment. And it's a little hard to appreciate, but his head starts to straighten out and he's not as crooked as he was. We did 2 full treatments with all the intensity. and then one little partial tune-up. And in 10 days, he was totally symptomatic free. But the part that the owner was most excited about was his entire skin was cleared up for the first time in his life. So reducing the inflammation cleared up his skin as well. Who did the first acupuncture? You know, doesn't it make you wonder, did somebody take a sharp stick and poke it in themselves or poke it in their friend? You know, where did that all come from? But of course, this mammoth is showing that maybe the first acupuncture was really the hunter shooting him in the butt, but his neck felt better. So this is Sammy. Sammy came to me at 15 years of age, acutely paralyzed. She'd been to her regular veterinarian who didn't have anything that they could offer. So then Sammy went to a referral center, and the referral center said Sammy probably had lymphoma in the spine and there was really not much they could do, so they should consider euthanasia, but the owners weren't willing to do that. So they came to me, we made a pact that we were going to go for 2 weeks, and if we didn't see any improvement in 2 weeks, we would put her down. Well, this is her in 4 days. If she never got past the crab walk, they would have been thrilled because she could use the litter box, and that was one of their biggest concerns. But she continued to get better, and this is her at 4 weeks. She continued to do fantastic. We tuned her up every once in a while, and she lived to be almost 20. Here she is getting Eastham acupuncture. What I didn't tell you was this cat was meaner than sin. So when she would come in her carrier, she would be hissing, biting, attacking, lunging, like you couldn't touch this cat. So every time we worked on her, we had to put her under anesthesia. But we finally got to the point where she actually started being a little nicer, and she let me put needles in her. This is Ireland, only 3 years of age, presented with acute paralysis. Just like Sammy, this is a degenerative disc disease, probably from all the processed foods and inflammation. And, you know, we know that inflammation comes out in the weakest link of the body, which in these cases, it happens to be the spine. So the owner brought her, he's a nurse, and he brought her in to put her to sleep because he didn't think anything could be done. That doesn't happen on my watch. This is her 3 weeks later. Now she stayed with me for the full 3 weeks because he was a nurse and his schedule was so crazy he couldn't bring her back on a regular basis. But is that not the cutest thing in the world? Adorable. This is Bama Bear. We went to their house to do a house call euthanasia. The crematory got there before me and was talking to these owners and realized that they were just told that there was nothing they really could do for this dog. He couldn't get up. He's a big dog. He weighed over 100 pounds, and the people couldn't pick him up. He was painful. So if they tried to move him, he would bite them. And so they thought there was nothing else that could be done. But after getting there and assessing him, they were thrilled that we offered to try and see if we could help him. So it turns out he had bilateral ACL tears, and that's why he couldn't get up and bear any weight. So we had to put a muzzle on him because he would bite the snot out of us. And here we are carrying him to the crematory truck, and she transported him to our office. And then this is doing the PRP and prolotherapy. We're using endo needles so that after I do the injections of his PRP, and then we do our prolo, and then we do the ozone. And I do 2 needles just so that I can do 2 lights at the same time. And I'm able to get things moving a little bit quicker and not have them under anesthesia for as long. So there's his Prolo mixture. We have a really amazing cocktail that we put together. And then
That was my prolozone.
can you ask
This
Melissa?
is my ozone,
Just run upstairs and ask her to answer that. We'll call them back.
about 3 or 4 cc.
And then,
back in the joint.
so that's how we do that. And then we do the laser lights. This is a video of him. Of course, this is done under anesthesia. And since it was bilateral, we had to do both knees at the same time. And then here he is immediately post-op. Remember, this dog hadn't been able to walk for a week. And that was just immediately post-op. He's walking all over my office, just trucking along, and he continued to do fantastic, and he's still doing great. So that was a good story. This is Kit Kat, male neutered cat. They had real chronic problems with these cats getting urinary blockages. He was on processed food. Well, after the 3rd time he blocked, the owner thought that she could express his bladder, and when she tried to do that, she actually ruptured it. So on the right hand side, you can see that big space that was where he ruptured his bladder. Well, fortunately, he ruptured it at the apex and not the base. And so
So we just opened the abdomen and here is the rupture. So we can see where there's a lot of necrosis. We're going to culture this, but fortunately it's in the body of the
so all that was
bladder. Looks like there's
necrotic.
another area here.
We
is
had to resect
starting
all
to
of that.
get
And what was
necrotic.
left was this tiny little bladder. So we kept a urinary catheter in so we could keep his bladder nice and empty while it was healing. It has amazing ability to re-stretch itself. And here he is. Well, we did a workup on him. We didn't get these results right away, but the TK1 was so high because of all that tissue necrosis that was happening in the bladder. He was vitamin D insufficient. He was low in B12. He had almost no liver enzymes, had a high white count. We cultured E. coli out of that bladder. So here he is, literally post-op. He's getting his frequency therapy and some vibration. You can see the urinary catheter is taped in there. And then after 10 days, we did a surgery to convert him into a her so that we didn't have that problem with him blocking again. And he's done fantastic ever since. We're almost done, guys. This is Tinkerbell. Tinkerbell went to their veterinarian because she was vomiting and not eating. And the veterinarian did some blood work, saw that she had a lot of abnormalities and she had some jaundice going on. So they referred her to a referral center. The referral center did an ultrasound and said that she had liver disease and that she should be put to sleep. And the owner didn't want to do that. So they went to pick her up. And then the owner called me from the exam room where she was there with the veterinarian from the referral center. And the referral doctor said to me, if you take this dog out of this hospital, it's going to die. And like really tried to make the owner feel bad. Well, we took the dog in and those numbers were really bad. We started out with a white count of 75,000. That's super high. And you can see on consecutive days, the dog is getting better and better. So from 7.7 to 7.9, white counts improving, neutrophils are getting better. Her liver enzymes didn't even register on our in-house machines, but then finally came down to where we could register them. Her alk phos was over, it didn't even register day one. Then we got it down to in the close to 10,000 mark. And then it continued to drop. Bilirubin was off the charts, got better, better, better. And so the dog stayed with me for literally 24 hours a day for 2 full days. So she slept at my house where I have a little hospital ward. And on the left is all the different things that we were doing, from our IV therapies to all the medications we were getting in. I did every tool I could think of on this dog. And here she is, day
I'm trying to do
3,
this one-handed.
chowing down.
She loves this. Oh, hold on, you're getting my finger. Hang on. This is her eating our absolutely brand new, just came out of the oven, freeze-dried raw food.
So she went home and continued getting outpatient therapy and continued to do very well. This is my favorite case to present because this was this year's case. Well, actually, last year's case. This is Bentley. He's a yellow lab, just turned 5 years of age. He developed some blisters on his nose. So the owners took him to their vet. The vet gave them a steroid cream. The bumps got worse. They did a biopsy and he was diagnosed with squamous cell carcinoma. They went to a referral veterinary oncologist who told them that the only cure for this dog was going to be to cut his nose off, literally. And they ran out of there and found me. So here we started our process. And though I'm not going to read everything, I want you to know that this dog was vitamin D deficient. He was also low in zinc, selenium, copper, and magnesium. He was very high in strontium, antimony, mercury, and lead. Of course, we didn't have that back right away, but as our workup came in, we did all kinds of diagnostics on him. This was what the owners gave us supplements. That is a amazingly dedicated family to get all this in. So we changed to a raw diet. He was on our essential vitamins and minerals, fatty acids, aminos. He was on pancreatic enzymes with and without meals. He was on our 8 mushroom blend. These are all products that we carry. He was on a humic extract to repair the leaky gut. He was getting kind of like an SCACT with cat's claw. Salvesterols. He was on kefir. He was on dimethylglycine, amygdalin, low dose naltrexone, black seed oil topically and orally, kava oil, hemp oil, vitamin C orally. We did bioenergetic scanning, and he was on all the imprints, and he was on vitamin D supplementation. And there was probably a few more things that I didn't list, but you get the idea. This was his therapies. He came in twice a week. And then they also bought a Weber watch for home use. So at home, they were doing other therapies, but I had him twice a week. So again, tremendous amount of work went into this dog. He was doing very well. At one point, we ended up adding 5 ALA topically, and we also did ICG, both intralesional and IV, and I'll show you those as we move along. So that was his IV therapies that we did twice a week. And then in March, that's what his nose looked like. The lesions went not only around the front of his face, but also up the side and over the top. And it was like whack-a-mole with this dog. Every week, there would be another new lesion that would show up. So you can see the one on the right-hand side. I got a black arrow going to it. That one shows up, and then another one would show up. And if you look at the picture on the left, you can see on the upper left nostril, there's a little round bump. So another one was coming up, but we got rid of the first one. We started out using something called neoplazine topically. It's a derivative of bloodroot. And I was just trying to get some of these lesions down. He had a lesion in his oral cavity as well. That one went away with no problem at all. And then we get into July, and the lesion is starting to coalesce, and we're getting a lot of erosion, but not a lot of new growth, except on the outer edges of the right side of his muzzle, and also on the inside of the left nostril. So you can see he's starting to really have quite a response. And then on 7/27, the following week, we did all of his IV therapies, but we didn't do anything topically. And then a week later, he comes in, and that's what I get presented. It was really nasty. So under surgery, I lasered all of this extraneous tissue, went down pretty deep. And then I ended up doing neoplazing again. This is how we had to treat this dog, because 1, it was painful. 2, he's a lab, so he's going to lick, 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 lick. So we had to do all these treatments were done under general anesthesia. The neoplazin had to stay on for an hour. We had to bandage it on to keep it there. It was just a lot. It was really hard on him, and it was really hard on us. But he's such a great dog. So here he is getting a sonic treatment, and then he knows everywhere he's supposed to be. It was time for hyperbaric. He just jumps right in. It was the best dog. He's still doing fantastic, and we really enjoy him. So here we put 5 ALA on, and we had to do this under tranquilization because the product has to stay on for 3.5 hours. And then we photo activated at the end of 3.5 hours. So then we see what his muzzle looks like on the right. This was the following week. We changed to ICG. We did the ICG intravenously and intralesional, and then we photo activated with infrared light. And that was him at the end of his ICG. And again, most of the lip is looking good, except for the left nostril and the outer edge of the right lip. Happy dog, always. Such a good patient. Here he is getting ALA. So we did ALA, ICG, and back to ALA. But we're really seeing some awesome changes in the tissue. And that was just a video showing where we could see the 2 areas that still needed to have some work. And then we started seeing something magical. All of a sudden, we weren't seeing any more of the cancerous tissue. And we started to see some scar tissue starting to contract in. Here he is in October, and then November, and the end of November. He's looking better and better, but there's still a little lesion in the left nostril. Now it's starting to really contract down. And if you were to see this dog now, you would not even know that anything happened. There's almost no pink left. And then on the left nostril, you can see there's still a little bit of a lesion, which we're working with. So in February, we decided to do methylene blue, and photo activate that. And then we did cryo and we did another neoplazing. So we kept playing around with different things. Here I'm going to be cryoing it. We had done on this particular visit, we did neoplazing. And then after we rinsed it off, we froze it. And that's what it looked like right after the cryo. So I was thinking, wow, we really did really good. This is a graph for those that really like the science part. We were following his vitamin C plasma concentrations along with his TK1 and his CRP. And the graph demonstrated that as we were killing the cancer, the TK1 would go up with the therapy that we were giving, and then it would drop down. And each week that we were testing, we were seeing less and less tumor mass. So there was less and less TK1. And this is just showing again a little bit further out that we went. And the two gray spikes that are in the background were the TK1. And that was when we did the ALA and the ICG. We got a really good kill effect. So here he is getting his methylene blue. On the left is his pre-methylene blue, then the methylene blue, and then post photodynamic therapy on the third treatment of methylene blue. So it was looking really good. And he was actually in the office today. And I still can't decide what's going on in that left nostril, but doesn't seem to be any tissue reaction. So he did really good. And this is Ratchet, 8-year-old male neutered bully that came in looking just like that. He had been to his veterinarian because he broke a tooth. They took the tooth out and he kept bleeding and bleeding and bleeding. So they sent him to the referral center, and the referral center did an ultrasound, worked the dog up, and they found that he had splenic lymphoma. So in this ultrasound that was done by the referral center, they did a fine needle aspirate, and that's how they came out with their splenic lymphoma diagnosis. So the spleen's really enlarged. It looks nice and motley and very nasty. So we started doing our treatments with him. On the left is what his live blood looked like when he came in. It was sludge. And then he did 1 hour in the PEMF device, and we actually had some aggregation. It was starting to break down and move better. We continued our therapies, and this was him at the 3-week mark getting therapies. And at this time is when we saw his clinical improvement as well. So it makes sense. Now he's able to oxygenate, bring oxygen to the tissues and get rid of waste products. And so he was really functioning much better. And then the owners wanted to see where we were at the 10-week mark. So we re-ultrasounded him, and all of our ultrasounds are read by a board certified radiologist, even though we do the ultrasound in the office. And the radiologist said he was cancer-free. He thought we had a misdiagnosis in the beginning because we couldn't see anything in there. So I sent him the original films, and he goes, "Oh, wow, that was pretty awesome. Did you do chemo?" And I laughed and said, "No." So there he was, cancer-free after 10 weeks of therapy. This is Moon. She also presented with a transitional cell carcinoma. She could still pee, but she was getting very symptomatic. We treated her for 5 weeks, and she was cancer-free and has remained so for years. This is Tucker, 4-year-old male neutered Great Pyrenees. Came in from another veterinarian because he was limping. They took an x-ray. He was diagnosed with an osteosarcoma. Here you can see the periosteal reaction, the swelling, the lytic lesion inside the bone. He was presented limping, but after only 2 weeks of therapy, he was already using his leg again. So this is 2 months into therapy. Here he was the first dog in the United States to get photodynamic therapy. So he's got a catheter in, he got the rainbow along with all of his IVs. And at the 10th month of doing his therapies, he was also confirmed with the resolution of the osteosarcoma. This is Little. He presented with this eye tumor. He had had this thing removed 2 times prior to coming to me, but they didn't treat the underlying cause. So it grew back quickly and with a vengeance. So we went in surgically to remove this. We get to be, all hats on. So this was really quite fun and very stressful. But as I was able to dissect the tumor out, where I have it, the letters say where area where the tumor was, that's where the base of it was. And I did actually use neoplazing on the inside of the eye, was just careful not to get it on the eye globe. And here he was post-op. The tumor was so large underneath the lids that it caused this massive amount of stretching to the lids. And you sit there and go, man, how is that ever going to get back to normal? So there he was post-op, and he looked pretty miserable. That's him 5 months later. He's visual, all that tissue contracted down, and he never had a return of his cancer. So we are almost out of time, but I've got a couple little things I still want to share. You know, a lot of times we'll have veterinarians and owners go, well, why would somebody spend all that money and time? You know, they're going to die anyway. And what I want all of us to do is take a moment and think about somebody that has transitioned in our lives. It could be two-legged or four-legged. And as you bring their memory forward, I want to ask you, what would it mean to you if you could have that individual one more day? What would you say? How would you spend that day? It would be super valuable. And that's what our owners are asking us for, one more day. They just don't want to give up too soon. Which brings us to Little Bit, and Little Bit presented on emergency in full-blown status epilepticus. So we were able to stop the seizures, and this is what she looked like when we got the seizure stopped. So she still has severe nystagmus. She can't stand up. And it's my job to go out and talk to the parents and decide, as a 15-year-old, this dog probably had a brain tumor, which we later diagnosed. She did have a brain tumor. We also diagnosed her later on with Cushing's disease. She had all kinds of deficiencies. She had severe pancreatitis, blah, blah, blah. She just had a litany of things. And so I gave them a poor prognosis. And I said, do you want us to continue and try, or do you want to say goodbye? And her words to me will forever live in my heart. She said, we had a dog years ago that we gave up too soon. We never tried. And we've never forgiven ourselves for not at least trying. So they said, do whatever you can. So we treated her that night. And this is her the next day going home. Now, she did not live forever. Of course, she had all kinds of problems. And about 7 days later, she had another seizure, which was severe. And at that point, the owners were more prepared to say goodbye. It doesn't make it any easier, but they now knew that they had done everything they could. And we had a lot of her test results back. So they knew the severity of some of her condition. So they were more comfortable with making that decision. And our last case is Prowler. She is a female spayed American Eskimo, very much a family member to these people. They owned a gym, so she spent all of her days in the gym with the family. She had developed a liver cancer, and it was huge, and it engulfed the entire liver. She went to their regular veterinarian, who finally said there was nothing more that they could do, and they suggested euthanasia, but they just weren't ready to do that. So when she came to me, she looked really, really sick. She wasn't eating. She had no energy. We started doing our therapies, and they didn't have a lot of money. They had literally $500 a month was their budget. So we only treated this dog 1 day a month. Now, I also threw a lot of extra free things in there, but they were able to spend a little extra money on her supplements. And this was her on her 12th birthday, 1 year later, celebrating her cancer-free status. We re-ultrasounded her after a year of therapy, and the radiologist said there was no evidence of cancer in her liver. So, you know, where does that leave us? All of us are in a position to do things that no one else has done. And they talk about the difference between a master and a beginner. You know, the master's failed more times than the beginner has ever tried. And all of us that are out there forging a new path and trying to find remedies that are safer and more effective, kudos to all of us, because we're making the difference in the world. And then Tony Robbins saying, if you can, you must, and if you must, you can. But he also says the number one reason for failure is a lack of resourcefulness. And I think that most describes how I've embraced my journey, is that I never want to be without something I can do. So I become more and more resourceful so that I can offer my patients something, even if it's quality of life and a better transition. I think that's really important. And look who came in for the finale. This is Echo, who is about to turn 23. So there you have it. I really appreciate you allowing me to share my passion with you. This is all the ways you can connect with me. The holistichealingvet.com is a free ebook that outlines those steps that I just went over with you in the beginning. I have Transforming Vet Medicine is my site for my online training courses. I train pet parents and hold on a second. Alyssa, can you bring my charger down really quick? I'm about to next to my bed. So Transforming Vet Medicine is my site where we have educational courses for pet parents, and I train veterinarians as well. Evo Love Raw is my food and supplements because we couldn't find good things that we could use for our pets. So I had to create my own. Spas, family wellness centers are detox centers where pets and parents come in for the detoxification of the 6 organs of elimination. And that will be open at the end of this year. We're doing it now in my office, but it's going to be its own independent franchise. And then we also make essential oils, and the last icon is my veterinary hospital. So yay, we made it without losing my battery. And that's the end. So thank you so
Wow.
much.
Thank you. Wow, that was great. You know, with most of us, this is foreign territory to us. So I'm hoping some of our regulars who I don't see on here tonight didn't decide, well, veterinarian, I'm not interested in it, because this was unbelievable. And one of the questions that as you're going through all of your cases and whatnot is, you have a lot of expensive equipment, don't you?
Multi-millions.
I was going to say, this costs a lot of money to set up all of
It
those
does.
modalities.
But, you know, Doc, when I made that commitment that I was never going to say to somebody, there's nothing more I can do, that meant I had to back that up with something. Now,
Mhm.
honestly, between all of us, from a quantum physics perspective, we can heal with just our mind. Yes, I accept that as truth, but to really put that into practice when you're dealing with somebody else's mind, you know, when you're dealing with a pet parent who may not have that level of belief, it makes it more challenging. And so I love my toys. They really help me to make my practice much more believable, and it's proof of concept. So, you know, I'm really
Great.
adapting what I do from you guys and just
Mhm.
making it work in the pet world.
Mhm. So there's some questions in the chat, and some of them were from like right at the beginning, and I don't know if you remember this, but one question is, what did you find with Lily? So I don't know if you remember what Lily was.
Yes, Lily's my horse.
Oh,
Lily
okay.
had arthritis in her neck. So in a training barn, horses' teeth grow and they get little points on the either medial or lateral side of the teeth. Well, in the barn, they were not using a good dentist. And so she wasn't getting her teeth filed properly. So they were uneven and she had a lot of points. Well, her job was to tuck her neck in. She had to break at the pole, which is C1. She had to be able to break at the pole, tuck her neck in, and then stride out with her front legs. Well, because she couldn't unlock her jaw because those little bone spurs were holding her jaw in place, she couldn't break at the jaw. So for years, she was having to strain her neck and she developed severe arthritis. And it was my first chiropractic class in veterinary medicine where one of my teachers does a lot of horses, and she goes, "Oh, I know exactly what's wrong with your horse." And so she went out with me, and sure enough, that's what it was. So we got her teeth properly filed, but the arthritis had already set in.
We'll introduce you to Dennis Harding. He does C1 balancing. He gave us a lecture on that. That's all he does is C1
Oh, I would
balancing.
love that.
It's some
I would love that.
some sort of device that he has. So
Absolutely.
what is evaluating 4th phase water?
Wow, I could spend 2 hours talking about that. And if you'd like, I would love to do a presentation on 4th phase water. But Gerald Pollack is a professor, I think, in Washington State, and most of his research is what has brought that. There's a few other people that talk about 4th phase water, but when we went to high school and all, we were taught in science that there's 3 phases of water. There's actually a 4th phase. It's a gel phase, and that's all the interest, the matrix that holds all the cells together. That's actually a gel phase. And so inside the cell is structured water. That's where all the communication occurs. And when we do things like eat toxins, we're exposed to EMF, we have a variety of different things. It causes a collapse of that 4th phase of water. And when that happens, the cells collapse on each other. They lose their polarity. when you expand the fourth phase of water, you get a negative charge around the cell. And then all of the positive ions are pushed out into the bulk water. And so you get this polarity change. And that's actually what they now believe is what drives the blood to circulate. It's not the heart. You know, physically, the heart could not pump blood through that kind of a system effectively. So what they really think is happening now is it's the fourth phase of water that when it's properly expanded, and it's expanded by things like infrared light will cause it to expand, certain enzymes, lymphatic therapy, ozone, all these different things are able to structure the water, expand the fourth phase, and allow it to work better.
Okay.
But yeah,
Yes,
we could
we
have a
will-
whole lecture on that.
We will
Hey,
have you
Doc,
back.
hey,
for
Doc.
that.
Hey,
Yeah.
Doc, can I interject real quick? What was the last chiropractor you were talking about? What was his name?
Dennis Harding?
Yeah, Dennis Hart. He's a Apex chiropractor, and Dr. Dan Halsey, who's on this tonight, he now has a Apex machine, and he's seeing some very high level results. There's only 4 centers in America right now that have this Apex machine, and it's a 3D Apex machine, and it's the top bone in your spinal cord where the 2 blood fluid centers go to the brain. So they're seeing absolute massive results. So hopefully we get them on.
Yeah, I have Dr. Halsey for April 18th,
Awesome. Okay.
and we've had Dennis on before, so
Yeah,
I'm gonna
exactly.
hijack him again. So,
Thank you.
Amen. You bet.
how many sessions for lymphatic therapy?
It depends on the case. As a preventative, I recommend that once every month or couple months or every quarter, if they're eating a species appropriate diet and they're getting movement. So the problem is a lot of these animals aren't moving. So they just like people, they're getting stagnant, and then they have surgery, you cut through lymphatic areas, you know, so there's a lot of toxins. So depending on the case, what their health challenges are, we could be doing lymphatic twice a week for our cancer patients if we need to, or once we get them on to maintenance, it could be once a week and then drops down to once a month. And then kind of I don't do as needed. I really think that they need to have 3 or 4 times a year. They need to have really good lymphatic therapy done.
Okay. Where do you get freeze-dried raw food?
I make it. It's our own company.
Oh,
So
there you go.
yeah, and we have a commercial freeze dryer. So yeah, the food is processed through a manufacturer that does it for me by my standards, and then we freeze dry it at my office.
Amazing. Do you recommend cod liver oil?
For vitamin D, or we don't typically
yeah.
use cod liver oil. A lot of those cod liver oils are rancid. In fact, a short, quick story is I was taking a cod liver oil from a company, Blue Mountain, actually, and I was using their cinnamon flavor, and it was rancid, and I didn't know it. And I started having heart arrhythmias, like to the point where I was having PVCs out the wazoo, and went to several cardiologists. This is back 20 plus years ago. And they said that I had right ventricular outflow tract disease, and they were going to do an ablation on me. So right before the surgery, I was just feeling so bad. I was on medications. I had no energy. I could hardly lift my legs out of bed in the morning. So I just said, chuck it. I'm going to go off all these drugs. I didn't want to be on anything, but I also stopped my supplements at the same time. And by the time I went in to go for surgery, all the PVCs were gone. And it wasn't until years later that I had found out about the story of this Blue Mountain cinnamon flavored cod liver oil that was rancid. But we use, for our fatty acids, we use a plant-based parent essential fat that is the omega-3 and omega-6 that make up the cell membrane. And that's what we use. And our animals do really, really well on that.
There's a question, and then somebody else answered it. What is rouleau?
It's when the cells stick together. And interestingly, when we were in veterinary school, we were told that cats and horses normally have rouleau. It is a total lie. They've just never seen these animals with the cells separated. I can separate it with energy, with enzymes, with ozone, and make the entire rouleau go away. And the animals function better.
Okay. Actually, the next question is, didn't the sound therapy have the same effect on the live cell analysis? Then why use ozone?
Well, ozone, I'm not using ozone just to cause cell separation. I'm using it as a hormetic stressor. I'm using it to produce more glutathione, to oxygenate the tissue, to do vasodilation. It's a redox signaling molecule. So it has a gazillion different effects.
Good. I hope that, Dr. Smith, if you're still on, I hope that answers the question. What do you think of, have you used Noni? N-O-N-I.
Noni. I know what Noni is. I haven't used that. It's an antioxidant, I believe. It's a fruit. And there's a company that's an MLM company that has Noni juice. Is that, if I'm on the right track?
Dr. Stone, are you still here?
Yeah, yep. Yes, I use that, and you can get it from the Samoan island. It's where they started using that, like medicine men, started using that in the salve, and you can get the juice. I found out about it, many years ago, and right about when I had found my beagle had a really invasive, fast-growing sarcoma. She had a surgery to remove these huge tumors that were growing so fast. And then, like, halfway through treatment, I found out about the nani juice. So I started giving that, and started seeing those tumors not only stop growing, but starting to shrink. Unfortunately, enough damage had already been done to her liver that she didn't make it. But I think had I known about the nani juice in the beginning, I think I would have been able to save her. So yeah, it's got a lot of, it helps the CD4 cells count go up. It helps with pain. It's really good pain. It helps. It's like, I know a lot of veterinarians have replaced like steroids and pain meds with that. So, so I just wanted to ask you about that.
Yeah, thank you for sharing. Yeah, I was
Thank you.
familiar with it, but at the time, the company that approached me when they had it, the Noni portion was great, but then they had other additives in there that were no-nos for me. So, and it was an MLM company, which I'm not against MLM. It's just the way they were pushing it, it wasn't congruent. There's just no magic bullet. It's, as you saw from the complexity of things that we do, we have complex disease, and it requires a equally complex comeback, so we have to stop doing the things that are causing it. We have to make sure essential nutrients are on board. We have to make sure that we've healed their leaky gut. Detoxification is huge. With the last little case that I showed, we tried to do her treatment too fast, and we made her sick because she couldn't detoxify. So we had to back up and do a few days of detoxification to get her to where she felt better and could actually get rid of some of the junk. And then we were able to start doing her therapies. And then not only the mitochondria, but all of our biochemical pathways. I really target those pathways. So salvestrols target the CYP1B1 pathway, which I think is fascinating that we have in our bodies all these cancer pathways, anti-cancer pathways, but we're just not eating the nutrients that trigger them. So if we can turn them back on by supplementing them with the products that will actually turn them on, something as simple as B17 or apricot seeds, and then salvestrols. It's amazing what the body can regenerate and do.
Great. Do you use, is that,
Yep. Thank
that
you.
answer your question? Do you use sterile methylene blue to apply to the wounds, or non-sterile?
Well, is our pharmacist here? I don't
Mike
think
Beamer was on for a while. Yeah, he's on the phone.
Mike,
Hey guys, I'm here. Yeah. Hi, Dr. Siegel.
Hey, Mike is amazing. Let me tell you, he works up all my methylene blue cases with me, and he helps me. I'm the one that's getting the gray hair. He's not, but
I have no hair.
we did a cat the other day that came in with a cancerous lesion on the face, and I'm looking at, because cats get hemoglobinemia and they get Heinz body anemia, so I was really nervous about doing the methylene blue, but I thought, I'm going to go for it. And then I called Mike and I go, did I just kill my cat? He's going, no, you're fine. So, and the cat did great. Yeah, the cat did great.
What you're using is I don't know if you guys know about Quicksilver, but Quicksilver is a company that makes liposomal products and nanosomal products. And so they have a new topical product that we're working with them to help develop. And what we sent to Dr. Siegel is methylene blue in that vehicle, and it has 40 nanometer microspheres or whatever you want to call them in it. So it's really Quicksilver's creation is the vehicle, but we're putting the methylene blue in there, and that's what you're testing.
Yeah, so it's not sterile per se,
No,
but I'm not using it intravenously. I'm using it topically.
and you're going to do PDT over the top of it, which is probably going to take care of any residual potential problem. Plus, it's pretty clean.
Yeah, we've done 2 cases with it, and so far really successful.
Mhm.
Okay,
Well, thanks for everything. Thanks
thank
for everything
you.
you do. You're a master. Yeah.
Thank you, Mike. I appreciate your time.
Something probably a lot of us were thinking about. It seems kind of cost prohibitive with a lot of these treatments. I mean, some of those protocols have to cost tens of thousands of dollars. It's
So I think my most expensive case has been around 80,000 for a cure, but I think the averages can be anywhere from 10 to 30. And it's not uncommon for chemotherapy in pets to be $15,000, $20,000, $25,000. So it's really not that far off, but our patients have quality of life the entire time.
okay. Well, Dr. Anderson, DVM says, nice work. Glad she joined. Glad if you're still here. Thank you for being with us. I know we're just medical doctors for the most part, but don't look down on us.
No, got most of my training from you guys, so thank you.
And this is kind of just a statement from my colleague, my sidekick Joel here. This has been one of the toughest classes I've been through. He had to put down his border collie last year, who became his service dog last year, and he was the mascot at our office. He didn't want to go through that again, but now he knows there are vets like you, and he's been invited to get a new service dog. And there's also an equine center, I guess, in town here. So it's a thank you for that. I got a lot of thank yous, fascinating. Thanks for coming. Happy that you shared your work with us. Thanks for one of the best lectures ever.
Wow.
Pretty good.
Thank you.
Yeah, that's not bad. You're doing such wonderful work for our beloved four-legged friends. It's great to know that there are fabulous vets like yourself. Medical question. How long do you retest live cells?
It depends. If I'm wanting to see an effect, I can do it as little as 5 minutes if I want to see a profound effect and how quickly. But when I was doing studies, if I didn't see an effect in 5 minutes, then I would do 15, then I would do 30, then I would do an hour. And then maybe it was 24 hours. So it really depended on what I was looking at. Some things reacted extremely fast.
How big a staff do you have? You can't do all of this only by yourself.
My daughter's my main key person, and I have another full-time technician and one other staff member. So it's really just 4 of us.
Wow. Okay.
Yeah.
Do you always do live cells after any intervention?
Not always, but because I teach a lot, I try to do more in the way of documentation. So we've got tons of videos. Our phones are just blown up with gross things. So, so a lot of times I don't charge the client, but if I want to have more data points, I'm working with a company right now that infuses frequencies into material like t-shirts and vests. And so I'll do thermography, x-rays, and live blood before, and then I'll put the shirt on, and then I'll test them again 30 minutes later, take their x-rays and repeat the live blood and just see what are the clinical changes that occur.
Do you ever deal with like frequency specific microcurrents? Have you ever dealt with that?
Explain that, be more specific with the question.
The microcurrent machine that will specific currents for specific organs.
Yes. So I have a sonic machine where I can actually dial in the specific frequency. I can go from increments of 1 hertz and change, and then also target specific tissues as well. Yes.
Okay, that's exactly what it is. So in the two-legged world, Carol McMakin, who will be on with us when I can twist her arm again. She was on last year. She runs an outfit with like 5,000 followers that do that for again two-legged folks. Do you do telemedicine?
I do.
Okay. Is Quicksilver Methylene Blue available commercially?
Mike?
Mike?
Hi, Bill. Yeah, yes, it is. It's, yeah, it's just a vehicle. So yes, you can order it. I think just me and College Pharmacy have it right now because it is kind of in testing, but it's a vehicle that they've used in their business in the past. And it's CGMP, and all that. So it's very good stuff. But yes, I do have it, and you're welcome to it. They're actually working on developing it for hormone replacement therapy as a sublingual vehicle, but it works fine topically. And the nanospheres are so small that they're probably pretty well taken up. So, but we have it in other forms if you need it too. But yes, definitely available.
I know. I hope, because we use their AMPK and it really tastes awful.
No,
and I've told that to them to their face too. So.
Yeah, if you take the AMPK and you dilute it with some water, it's not bad. You just can't take it straight.
Well, we're actually using it as part of our weight loss program, and it actually works quite well because after you take a teaspoon of that stuff, you're good for at least 8 hours. You don't want to eat anything. It actually works quite well. Thank you for wonderful work. For those this is Joel. You have a discount for veterans and responders.
Sure, we'll work it out for you.
Okay. Outstanding. Thank you for this great lecture. This is really different for us, and we're really happy to have you with us. I know you've been with us for a few weeks, and Dr. Lopatin, that's a new name to us. If we can get your contact information so we can tell you about all our events. Those of you who don't know, we're here every Tuesday night, 5 p.m. Pacific, 8 p.m. Eastern. And Dr. Siegel, I can't thank you enough. This has been really, truly terrific.
Well, thank you, Mike. He invited me into the group, so thank you, Mike, for that, and love working with him, and really am very honored to be a part of your group.
I just want to chime in real quick. You say this is different for us, but in actuality, the similarities are absolutely mind-blowing.
Yeah, I agree totally, because most of what you've gone through is what we as doctors we want to, and because of our incompetence, either economically, financially, or whatever, politically, legal, we're not able to do all of these things. But the training, like Joel said, the training we've had is very similar to what you're actually doing, but you're doing it, we're thinking about it. So congratulations on putting it all together.
Thank you.
Thank you. Here's our website here in the chat, aosrd.org/webinars. I'm sorry I didn't get Dr. Patel's video up. It's been a little crazy around my place in the last week. I do have it. It'll be up there. And this one, usually we have them up within 24 to 48 hours. So it's there. All of our videos. We've been here for over 2.5 years now, so we have quite a library of information. Pretty much almost any topic now that you can think of in the functional medicine world. Dr. Siegel, thank you again so much. Next week we have John Cummings, who runs Body Sight, which is a software program that automates things like diet programs. So you can program in just about any type of diet you can think of, and if he doesn't have one on there that you like, you can actually write your own, and they will deliver nightly for anywhere from 28 days to 90 days, and continuously recipes, menus, and all sorts of. I've been using it. I've been with him actually since he started, almost 10 years, and it saves me a lot of time and effort, and having to pay a nutritionist, because it's all right. It's all spelled out right there. There's all sorts of videos on there. There's exercise programs, and it's really a terrific site. It's $199 a month, and it more than pays for itself. You can even sell your own diet programs and exercise programs on there. So he's going to be on next week. He'll be talking about that. Like I said, Dr. Halsey that Joel mentioned will be on April 18th. April 4th, Dr. Brad Watts, who's quite a prolific speaker, will be doing something on thyroid. I'm not sure what. And Dr. McMakin from the frequency specific microcurrent. She has a little bit of a conflict on Tuesday, but we're going to work it out. It's going to be a bit of a video for an hour, and then questions and answers. Anybody who wants to present anything, please let me know. I have endless Tuesdays to fill up. And if there's any topics that you want, any speakers that you want, please let me know. Word's kind of out there that we're doing some progressive things and some really good stuff. We're affiliated with Dr. Halassa's group on Monday, Dr. Farshian on Wednesday. There's a whole plethora of education out there, like I mentioned at the beginning, I'm trying to find a way to get registration, so we get all of our whoever's here, we get at least a contact for them, and to do it automatically. If anybody knows how to do that, either on Zoom or on another platform, please let me know, because I'm a little bit not savvy on that on those things. So if you know how to do that, please get in contact with me. I'll get you my email. It's drbill9@gmail.
By the way, Stefan already has that, and our neurosurgeon, whose name I just forgot.
Yeah, Avery Jackson. Yeah.
I think he's got it all together, and he can do everything you're asking to be
Okay.
done.
All right. Yeah. So yeah, I keep threatening to get in touch with him, and things keep getting in the way. Oh, one more thing, Dr. Siegel, before you go. Bioenergetic scan. What is that?
We use a Quest 4. It's very similar to the Azira. It's one of those woo-woo things where you're looking at the DNA of the animal. They do want people too, but you're looking at the DNA, and it's looking at the homeostasis of the entire body, organ systems, and all your metabolism.
Okay. I mean, there's some scans where you put your hand on this thing and it's supposed to read all sorts of things.
It's very similar to that. And it sounds crazy. However, it is so accurate. After all the years I've done it, I can't deny it anymore. It's really good. So I use it as another ancillary tool. But we're seeing a lot of Lyme's disease that is not being able to be picked up in the traditional testing, once it goes intracellular, but it really helps me to identify when we have either Lyme's or a co-infection.
Mm-hmm. Okay. Anybody else have any comments or questions, or if you have any complaints, keep it to yourself. But other than that, John, you got anything for us?
Oh, fantastic. Thank you, doctor.
Thank you
Okay,
so
thank
much.
you so
I really
much.
appreciate you guys. Thank you so much.
Okay. One last thing, I will be at AMMG April 26th to the 30th in Miami at the Doral National. And I'm doing, they gave me to do thyroid and cortisol. They gave me 45 minutes to do both. So they'll be getting the Cliff Notes version, and also be doing the new face of weight loss, which I've already done here. AMMG, if you're going to go to that, don't be a stranger. And other than that, everybody have a great night, and I will make sure that we will get the videos up as soon as we can. Okay, thank you so much, Dr. Siegel.
You're welcome. Thank you. I'll see you next week.
Please come again. You said you have a whole nother lecture. We will get in touch with you.
Oh, maybe we'll do water. Great.
Okay, thank you.
Bye.
Thank you.
Good night.